Okay, in this room you said is special?
This is special procedures. It's adjacent to the regular surgical suite, but it's also a surgery room, which is what we call a positive pressure room. That nothing comes into the room, everything, nothing goes out of the room, everything goes out of the room, nothing comes in.
Okay.
So it's a positive pressure room. In this room we do all our, what we call our dirty surgeries, our contaminated surgeries. Dentistries, because of the ultrasonic cleaning, might aerosolize a lot of bacteria. Mm-hmm. When we do colonoscopies or endoscopies, which are inherently dirty, contaminated procedures, we don't want to contaminate our sterile surgical suite, so we do it in here where we have a wet table. It's a complete enclosed operating room, again with central oxygen and evacuation, anesthetic machine. We also do our dentistries in here, and here we do our dental x-rays where we'll take an x-ray just like they would on us to look at the teeth, look at the roots of the teeth to see if we can identify where there might be abscesses, which teeth might be involved in a particular pathology and therefore need extraction.
And also you said you do ultrasounds.
We do. We do our ultrasounds in here, and it's a great three-dimensional, non-invasive way that we don't need to sedate a patient, yet we can look at three-dimensionally what's going on inside the abdominal cavity.
Amazing. I mean, it's amazing that all of these procedures, which basically we've assumed for years were only for people, are now available for animals, which is just marvelous. We're going to go back, we're going to take a look at the back, and briefly, and then we're going to let Steve go because there are people who are screaming that they want him. So come on, let's move back. Okay, we're going to have trouble talking in here. I feel like I'm back at Save-A-Pet. This is your dogs only ward, correct?
This is our dogs only ward. Our cats are in a separate ward so that they don't have to be subjected to all the dogs barking.
And this is where dogs will have to stay?
They stay when they're pending a procedure or an examination. They're not critical, so they don't need to be in intensive care. And after they come out of recovery, they'll come back here to the hospital ward. We also have 6 indoor runs as well as a fenced-off area outside the ward.
So you get them outside too?
Correct.
Terrific. Okay, we're going to go take a look at the cat ward, I think. It'll be quieter. And ever so much quieter. We are now in the cat ward.
Right.
Kind of neat that you can keep the cats separate.
We do, and the cats are a different breed, so to speak. They really don't react well to stress, and certainly if they're not feeling well, the less stress, the faster the recovery. So we've provided them with their own ward. It's a quiet room. There's no dogs barking. They might be able to hear them, but they're 2 rooms away.
It's not scary.
No, it's not frightening at all. It's very calm and peaceful in here.
Yes, it is. Okay, now there's one more thing I'd like to do if we have the time, and that's we talked about the examining rooms and how you have them equipped. Mm-hmm. And I'd like to do that, and I don't know how much time we have, I love that x-ray table. We haven't looked at that x-ray table.
We can do either, or both.
Let's look at the x-ray table. This is your wonderful newly equipped x-ray room.
Right.
And the table is fantastic. You showed me how this works. It moves, it slides sideways.
It does. It allows for us to move the patient without, actually moving the patient to wherever we want on the table, to whatever part of the animal's body. It'll lock in position, and then we can go ahead and shoot our x-ray. So the animal's not being required to move, but rather we move the table. The entire room is lead-lined, so once we close this door, nobody in any part of the hospital is being exposed to any of the x-rays, and everything's done digitally. It's all done on computer, and we can take these x-rays via a laptop, take it right into an exam room, and show people right in an exam room on mounted screens on the wall exactly where the problems are based on the x-rays. And then if we need to make copies of x-rays, they're put on a little CD. And they walk out of here with a CD-ROM instead of the big pictures like they used to.
And digitally, you can focus in on a place?
You can. You can focus in, you can enlarge, you can do all sorts of things. We can make this bigger if we want to look at this area and this lower lumbar spine. We can see all the pathology down here at L7S1, that there's a lot going on in this particular patient. And he's probably got a really sore lower back area, and that's why this x-ray was taken.
Mm-hmm. It's amazing. And Steve, I want to thank you for taking us and showing us and letting people know the kinds of things that are available, because your friendly neighborhood vet is a doctor and has at his disposal incredible equipment, which you've got going on here I'm really happy your place is beautiful. It is the first time I visited you since you moved.
Thank you. It's a pleasure to have you.
The stuff that's out now for animals, the lasers, the dental stuff, the x-rays, it's amazing what we can do for our pets now. And I think people need to know that if they need these things, they are available.
They are. They're available, and most veterinarians can do a lot of these things. And certainly at the specialty, hospitals where there are specialists, they can do even more with MRIs and CAT scans.
Steve, thank you for taking the time. We are turning you loose to go back to your conference, and we are now going to go to Save a Pet and show you some of the dogs and cats available there for adoption. Yeah. On the way out, we just wanted to stop and show you what an examining room looks like. The table comes all the way down to the floor so the dog can step on it, and then they can raise the table with the dog on it, so you don't have to lift the dog or lift the dog off, which is very nice. They have the screen over there where they can send x-rays, so that if a patient and the patient's owners are in the room and there's an x-ray taken, they want to show it, they can consult right here, which is very nice. They also have an otoscope, which is for checking the insides of the ears, and it goes on a screen so that they can show on the video what they're seeing when they look down a dog's ears as well, which is kind of neat. So again, small pieces of equipment that make things easier for the patient's family to understand what's going on.